Hey guys, this is Dr. Hub. Today we look at the neurotransmitters. So the neurotransmitters as well as the presence of the neuromodulators. So first let's look at the small molecule transmitters. The small molecule transmitters. The small molecule transmitters, there are various classes. So there is a class 1. The class 1 means the acetylcholine. So class 1 is nothing but the acetylcholine. Then comes the class 2. So easier to remember is A is 1, right? So it is acetylcholine. Next, class 2, we have the amines. So the amines, what is it including? There is a norepinephrine. There is presence of norepinephrine. Then there is also presence of the epinephrine. There is norepinephrine, there is presence of epinephrine. Then there comes the presence of dopamine as well. There is norepinephrine, epinephrine, there is dopamine. Next comes the presence of the serotonin. There is serotonin, presence of the histamine. So let's recap. There is a norepinephrine, there is epinephrine. There is presence of dopamine, there is serotonin as well as the histamine. Then we move on to the class 3. So class 3 of the amino acids. So class 3 amino acids, it includes the gamma amino butyric acid. So it includes the gamma amino butyric acid. So gamma amino butyric acid. Then it has all the G's basically. So there is a gamma amino butyric acid. Next we also have the glycine, that is also a G. Then there is glutamate, that is also a G. Next there is aspartate. And then we move on to class 4. Class 4, there is a nitric oxide as well as presence of the ATP. So this was about the small molecule transmitters. Now let's highlight on the large molecule transmitters. So in terms of the large molecule transmitters, it is nothing but the neuropeptide. It is a neuropeptide and it is a slow acting. It is a neuropeptide, it is a slow acting transmitters or the growth factors. So there is presence of the hypothalamic releasing. There is a hypothalamic releasing hormones. So under hypothalamic releasing hormones, it includes the TRH. So hypothalamic releasing hormones, there is TRH, there is LH, that is a luteinizing hormone. So luteinizing hormone, releasing hormone, and there is also somatostatin. Somatostatin, we know it is the growth hormone inhibiting factor. Next we look at the pituitary peptides. So under pituitary peptides there are a lot. So let's look at the pituitary peptides. So under pituitary peptide, it includes the ACTH. There is presence of ACTH. Then there is also presence of the beta endorphin. So endorphin, the beta endorphin is present. Next under the pituitary peptide, there is a alpha melanocyte. So there is alpha melanocyte stimulating hormone. Next is the presence of the prolactin. There is presence of prolactin, there is LH as well as presence of TSH. Next is there is GH, growth hormone, and the ADH as well as the oxytocin. So there is ACTH, beta endorphin, alpha melanocyte, prolactin, LH, TSH, growth hormone, ADH as well as the oxytocin. Next we move on to the peptides. Next we move on to the peptides that act on gut. the peptides which act on gut as well as the brain. So the answer here is there is the enkephalin, there is enkephalin, then there is presence of the substance P. So there's presence of enkephalin, there's the presence of substance P, then there's the presence of the gastrin, and there is also the cholecystokinin. So there's enkephalin, there is substance P, gastrin, cholecystokinin, there is VIP, and then the nerve growth factor. There is also the brain derived neurotropic factor. There is a brain derived neurotropic factor, as well as there is presence of the neurotensin. There is neurotensin, insulin, as well as presence of the glucagon. Next is from the other tissues. So the other tissues, it includes the angiotensin 2. Then there is also the presence of the bradykinin. Next there is the carnosine, sleep peptides, as well as the calcitonin.